All right, welcome back to Pharmacist on Call, your 1 hour forum to let out those burning questions that you have. We're going to get right back into your calls. We've got Mary. Mary on line 2. Welcome to Pharmacist on Call. How may we help you?
Thank you. I wanted to ask about what type of antihistamine is recommended for a patient who has glaucoma if you have allergies and sinus problems.
Something that I guess is not going to be pushing your pressure.
Right,
Well, that's going to be any of them, but I think the anticholinergic effect may give you a problem. The one that may have the least anticholinergic effect may be Claritin, which is the generic is loratadine. Because I think Benadryl would also affect your vision though it's not a.
Okay. What about nasal sprays?
Nasal sprays, they're going to have antihistamines and decongestants in them. So yes, just because you have them in the nose, they still get into the bloodstream. And believe it or not, everyone, they also can push up your blood pressure because they're still crossing the mucosal area, getting to the bloodstream. So we have to be careful with those as well.
Okay.
Yeah, but Claritin, I think, would be your best bet.
Sidebar, what's on your blazer? What's that on the right-hand side?
It is David Lipscomb, LSU, Smyrna Bulldogs. No, ma'am, it is nothing but Omega Psi-Phi Soul Fraternity Incorporated, founded November 17, 1911, on the campus of Howard University.
Manhood.
Yes, ma'am. Manhood, scholarship, perseverance, uplift. All day long. Q Psi-Phi to the day I die.
I appreciate it.
Yes, ma'am.
Take care.
All right, thank you. Yes, everyone, if you come into the pharmacy, it is all purple and gold from the ceiling to the floor. So I get a variety of comments, whether it's LSU, no, because I'm UT alumni, so I bleed orange. I bleed blue and white because I'm also TSU alumni, but it is about my fraternity colors. I just wanted to finish up about the water a little bit because I know there'll be a bunch of different questions. So the cost of the water, as I told the other gentleman, $3 per gallon. When you bring that gallon back for a refill, the cost goes down to $2. And so if you bring a container from home, an old milk jug or what have you, then that cost is still $2 for you. So you heard the gentleman mention that the other alkaline water store sells their water for $1. They can do that because their quality is not as high as ours. If you want the best water, sometimes you'll pay a little bit more. Our process is a little more in detail, but if you just want a full explanation of the water, call or come by. We'll give you the full rundown. You can see the systems. I'm not sure if the other water stores will allow you to do that, and we'll show you the exact machine that your water store should have, and chances are they're charging $1, they don't have the machine that they should have. Alkaline is a generic term. Kangen is the branded water, the best. All right, so look, line 1, welcome to Pharmacist on Call. How may we help you? Hello, Sandra?
Hello?
Yes, ma'am. How you doing, Sandra?
I'm doing okay. I was calling in to tell you I was hearing about Pharmacist, and my doctor told me that Pharmacist and Nexium can cause dementia.
Yes, that is true.
And so I'm taking Pepsid, 20 milligrams.
Okay. Now, how does that work out for you comparatively?
It works just as good.
Okay.
And I just wanted to say that my doctor said that it caused dementia.
Yeah, it does have some pretty rough side effects, which is why most people that come in the pharmacy, I have the lowest price on the lowest cash price on those in the city at $15 for 30 of those, which nobody's charging that low. But I try to steer people more so towards the alkaline water, simply because of A, the health benefits, B, how quickly it works. Pepsid is a good choice. It's actually an antihistamine, believe it or not. So it works on the H1 receptors there. So yeah.
Oh, okay.
Yes, ma'am. But yeah, Pepsid is a good choice. A little bit safer long term than the proton pump inhibitors. But like I said, I always try to steer everyone towards the water. Also, for those of you suffering from reflux, a lot of it is caused because we will eat heavy and then lay down after, a big meal. So what the issue is, physiologically speaking, is you'll have your stomach creating this hydrochloric acid trying to break your food down, and then you'll get itis, which is common in the South, and you'll want to lay down. But guess what? that stomach acid is going to rise as well. And so that's where we get that reflux and that burning, because we lay down too soon, the food hasn't fully digested. So make sure you're sitting up at least 2 hours after you eat.
Okay, I also have Barrett's esophagus.
Okay. So, well, yeah, I recommend the water for you then.
Okay. If I'm ever in Nashville, I'll come and get some.
Yes, ma'am. You're not far away.
I live in Cookville.
Oh, that's nowhere. We have Kentucky. We have West Tennessee. People drive for this water and for the beetroot juice, which I'm going to talk about in a little bit here, too.
I watch your program every time it comes on because it's very informative, and I would like to come to your pharmacy to get the water.
Yes, ma'am. Yeah. We'd love to have you. So when you can, come by.
Oh, okay. Thank you.
Yes, ma'am. Thank you. All righty. Okay, let's see. Also about the water, for those of you who live in the greater Nashville area from Hendersonville to Antioch, we deliver the water. So for free, if you have a 5-gallon order or more, we deliver the water free to you. So you don't have to necessarily wait if you live in the city to come to us. We can come to you. Let's see. We want to get into the beetroot juice here, which is our number 2 seller to the water. So this is a juice that is a superfood. It does a variety of different things. First of all, it helps with hypertension. In fact, it lowers the blood pressure in about, I'd say 30 minutes or less. Helps lower the blood sugar and the A1C. So for those of you who are diabetic and you want your medicine isn't quite getting the job done and you're still waking up with high blood sugars, or your A1C just won't quite come down even though you're on insulin and tablets, beetroot juice can help get it down. We have a ton of patients. Actually, the people who fare the best use the water and the beetroot juice together. This is also great for those of you ladies who suffer from anemia, because this is a very rich source of iron, natural source of iron. So great for anemia. For those of you who have issues with your pancreas, this also helps. So for people with pancreatitis and you start to get those pains, great for it. For those of you who have liver disease, I guess cirrhosis, hepatitis, this right here, pretty good. It has a chemical in it called betaine, B-E-T-A-I-N-E, because you got to remember this is beetroot juice. So what this does, it detoxifies the liver and also begins to heal it. Let's see what else. Oh, kidneys, also great for kidneys. So those of you who have kidney disorders, this is also going to be a good bet for you as well. Let's see. Oh, cholesterol also lowers the cholesterol. And for those of you who, if you're on chronic pain meds, high in fiber, and so I know that you tend to get constipated a lot, or for those of you who don't have a high enough water intake, this will clean you out. So beetroot juice, I order 20 bottles and it goes like that. In fact, after every show, people flood in and got it. So we just got like 20 in like yesterday. So I expect it to be gone tomorrow. So usually after show, I have to do a couple of different orders because people are getting to the point where now they hoard it. They'll buy 2 or 3 bottles at a time instead of where they used to just get one. But that's a testament to how well this stuff works. So I became a believer in it. I just experimented with some TDOT drivers who would just come in complaining that they never could get their blood pressure down to pass their TDOT physicals, and they were still on blood pressure medicines. They didn't know what to do. So I started giving them this, just a capful, 30 minutes before their test, and they all passed. All of them passed, even in the presence of medication. So they finally got their blood pressures down. So that is why we sell a ton of it. In fact, I think one of our viewers, she sent her brother to me, and he wound up passing his physical as well. I think she called into the show a little bit ago. But as it were, it looks like we're up on another break. I see the calls coming in. You stay right there. We will be right back.